I think everyone remembers the words that you first hear, that you have leukemia. My doctor came in and said, "Matt, you have leukemia and you have 6 months to get your affairs in order." My first thought was, who's gonna walk my girls down the aisle? My name is Matt, I'm 60 years old, and I'm living with CP CML. My wife was in shock, her family was in shock, and we all kind of wondered what those next steps would be and what we had to prepare for. It was kind of a whole new world. So I had to change my lifestyle. I had to change my work habits. I had to change the things I did with my family. The first TKI I took, I was able to stay on for 3 years before I was switched. And then I went through several TKIs following that. And then in my 15th year, I failed on the last TKI I was taking. And I was told that I needed to go to a clinical trial, that there were no approved TKIs for me to take. And then about a month later, we got news that Iclusig had been approved for patients who'd failed on 2 or more previous TKIs. And it was kind of exciting to know that there was an option out there for me to take.
What is Iclusig? Iclusig is a prescription medicine used to treat adults who have chronic phase chronic myeloid leukemia, CML, who did not tolerate or no longer benefit from treatment with at least 2 prior kinase inhibitor medicines. A specific type of abnormal gene, T315I positive chronic phase CML. Iclusig is not for use to treat people with newly diagnosed chronic phase CML. It is not known if Iclusig is safe and effective in children. Please see important safety information throughout and at the end of this video.
When I first began taking Iclusig, my doctor recommended that I take 45 milligrams once per day orally. And I took that for 90 days until my BCR-ABL was less than 1%. And then the prescription was reduced to 15 milligrams orally per day.
Iclusig can cause serious side effects, including blood clots or blockage in your blood vessels, which may lead to heart attack, stroke, or death. Heart problems, including heart failure, which can be serious and may lead to death, and can cause liver problems, including liver failure, which can be severe and may lead to death. You may need emergency surgery or treatment in a hospital. Please see additional important safety information at the end of this video.
I've been taking Iclusig now for almost 2 years, and the last 12 months, my BCR-ABL has been 0, which is really encouraging for me. And I've really been pleased with the results that I've gotten and the quality of life that I have while taking Iclusig. I know my results may be different than other patients. Taking Iclusig does come with some side effects. Those side effects are different for every patient, but I do have some GI issues that I have to deal with each day that are manageable. There is some fatigue that sets in. When I started my journey with CML, I didn't know what I would face or what my life would be like. What I wanted was time with my family, traveling, making memories, and being there for them. I find that I'm much more present. I think I'm a better father. I think I'm a better husband. In fact, I'm very proud that I spent about 4 hours one day building a fire pit in our backyard. And my wife told me that she sat out the window and cried when she saw what I was able to do. I had one daughter just last year in July who got married. And they always do that first look where you turn and you look at your daughter and all the fathers cry. And I did nothing but smile. And she's like, "Aren't you gonna cry, aren't you?" I said, "Darling, I was never sure I was gonna make it this far. So I am so happy for this day. Iclusig has made it possible for me to continue my journey with CML.
Important safety information. What is the most important information I should know about Iclusig, ponatinib? Iclusig can cause serious side effects, including blood clots or blockage in your blood vessels, arteries, and veins. Blood clots or blockage in your blood vessels may lead to heart attack, stroke, or death. A blood clot or blockage in your blood vessels can prevent proper blood flow to your heart, brain, bowels, intestines, legs, eyes, and other parts of your body. You may need emergency surgery or treatment in a hospital. Get medical help right away if you get any of the following symptoms: chest pain or pressure, pain in your arms, legs, back, neck, or jaw, shortness of breath, numbness or weakness on one side of your body, leg swelling, trouble talking, headache, dizziness, severe stomach area pain, decreased vision or loss of vision. Blood clots or blockage in your blood vessels can happen in people with or without risk factors for heart and blood vessel disease, including people 50 years of age or younger. The most common risk factors for these problems are a history of high blood pressure, hypertension, high cholesterol, and heart disease. Blood clots or blockages in your blood vessels happen more often in people as they get older, and in people with a history of decreased blood flow, high blood pressure, diabetes, or high cholesterol. Heart problems. Iclusig can cause heart problems, including heart failure, which can be serious and may lead to death. Heart failure means your heart does not pump blood well enough. Iclusig can also cause irregular, slow, or fast heartbeats and heart attack. Your healthcare provider will check you for heart problems during your treatment with Iclusig. Get medical help right away if you get any of the following symptoms: shortness of breath, chest pain, fast or irregular heartbeats, dizziness, or feel faint. Liver problems. Iclusig can cause liver problems, including liver failure, which can be severe and may lead to death. Your healthcare provider will do blood tests before and during your treatment with Iclusig to check for liver problems. Get medical help right away if you get any of these symptoms of liver problems during treatment: yellowing of your skin or the white part of your eyes, dark, tea-colored urine, sleepiness, loss of appetite, bleeding or bruising. See what are the possible side effects of Iclusig for information about side effects. What is Iclusig? Iclusig is a prescription medicine used to treat adults who have chronic phase chronic myeloid leukemia (CML) who did not tolerate or no longer benefit from treatment with at least 2 prior kinase inhibitor medicines. Accelerator phase or blast phase CML, or Philadelphia chromosome-positive acute lymphoblastic leukemia Ph-positive ALL, who cannot receive any other kinase inhibitor medicines. A specific type of abnormal gene, T315I positive, chronic phase, accelerated phase, or blast phase CML, or T315I positive Philadelphia positive ALL. Iclusig is not for use to treat people with newly diagnosed chronic phase CML. It is not known if Iclusig is safe and effective in children. Before you take Iclusig, tell your healthcare provider about all of your medical conditions, including if you have a history of blood clots in your blood vessels, arteries, or veins, have heart problems, including heart failure, irregular heartbeats, and QT prolongation, have diabetes, have a history of high cholesterol, have liver problems, have had inflammation of your pancreas, pancreatitis, have high blood pressure, are pregnant or plan to become pregnant. Iclusig can harm your unborn baby. Your healthcare provider will do a pregnancy test before you start taking Iclusig. You should not become pregnant during treatment with Iclusig. For females who can become pregnant, use an effective form of birth control during treatment and for 3 weeks after your last dose of Iclusig. Tell your healthcare provider right away if you become pregnant or think you might be pregnant during treatment with Iclusig. Iclusig may affect your ability to have children. Tell your healthcare provider if this is a concern for you. Are breastfeeding or plan to breastfeed. It is not known if Iclusig passes into your breast milk. Do not breastfeed during treatment and for 6 days after your last dose of Iclusig. Have bleeding problems. Plan to have surgery or have had a recent surgery. You should stop taking Iclusig at least 1 week before planned surgery. See what are the possible side effects of Iclusig. Are lactose, milk sugar intolerant? Iclusig tablets contain lactose. Eat grapefruit or drink grapefruit juice. See how should I take Iclusig. Tell your healthcare provider about all the medicines you take, including prescription medicines and over-the-counter medicines, vitamins, and herbal supplements. Iclusig and other medicines may affect each other, causing side effects. Know the medicines you take. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. How should I take Iclusig? Take Iclusig exactly as your healthcare provider tells you to take it. Do not change your dose or stop taking Iclusig unless your healthcare provider tells you. Swallow Iclusig tablets whole. Do not crush, break, cut, chew, or dissolve Iclusig tablets. Take Iclusig with or without food. Do not eat grapefruit or drink grapefruit juice during treatment with Iclusig. If you miss a dose of Iclusig, take your next dose at your regularly scheduled time the next day. Do not take 2 doses at the same time to make up for a missed dose. If you take too much Iclusig, call your healthcare provider or go to the nearest hospital emergency room right away. What are the possible side effects of Iclusig? Iclusig may cause serious side effects, including: see what is the most important information I should know about Iclusig. High blood pressure, hypertension. Iclusig can cause new or worsening high blood pressure. Your blood pressure should be checked regularly, and any high blood pressure should be treated during treatment with Iclusig. Tell your healthcare provider right away if you get confusion, headaches, dizziness, chest pain, or shortness of breath. Inflammation of the pancreas, pancreatitis. Tell your healthcare provider right away if you get any of the following symptoms: sudden stomach area pain or discomfort, nausea, and vomiting. Your healthcare provider should do blood tests to check for pancreatitis during treatment with Iclusig. Neuropathy. Iclusig may cause damage to the nerves in your arms, brain, hands, legs, or feet, neuropathy. Tell your healthcare provider right away if you get any of these symptoms during treatment with Iclusig. Muscle weakness, tingling, burning, pain, discomfort, or loss of feeling in your hands and feet. Double vision and other problems with eyesight, trouble moving the eye, drooping of part of the face, sagging or drooping eyelids, or change in taste. Eye problems. Serious eye problems that can lead to blindness or blurred vision may happen with Iclusig. Tell your healthcare provider right away if you get any of the following symptoms: bleeding in the eye, perceived flashes of light, light sensitivity, floaters, blurred vision, dry, inflamed, swollen, or itchy eyes, or eye pain. Your healthcare provider will monitor your vision before and during your treatment with Iclusig. Serious bleeding. Iclusig can cause bleeding, which can be serious and may lead to death. Tell your healthcare provider right away if you get any signs of bleeding during treatment with Iclusig, including vomiting blood, or if your vomit looks like coffee grounds, pink or brown urine, red or black looks like tar, stools, coughing up blood or blood clots, unusual bleeding or bruising of your skin, menstrual bleeding that is heavier than normal, unusual vaginal bleeding, nosebleeds that happen often, drowsiness or difficulty being awakened, confusion, headache, change in speech. Fluid retention. Your body may hold too much fluid retention, which can be serious and may lead to death. Tell your healthcare provider right away if you get any of these symptoms during treatment with Iclusig. Swelling of your hands, ankles, feet, face, or all over your body. Weight gain, shortness of breath, and cough. Irregular heartbeat. Iclusig may cause an irregular heartbeat. Tell your healthcare provider right away if you experience loss of consciousness, fainting, dizziness, chest pain, or palpitations. Low blood cell counts. Iclusig may cause low blood cell counts, which can be severe. Your healthcare provider will check your blood counts regularly during treatment with Iclusig. Tell your healthcare provider right away if you have a fever or any signs of an infection while taking Iclusig. Tumor lysis syndrome, TLS. TLS is caused by a fast breakdown of cancer cells. TLS can cause you to have kidney failure and the need for dialysis treatment. An abnormal heartbeat. Your healthcare provider may do blood tests to check for TLS. Drink plenty of water during treatment with Iclusig to help reduce your risk of getting TLS. Reversible posterior leukoencephalopathy syndrome, RPLS, also known as posterior reversible encephalopathy syndrome. Iclusig may trigger a condition called RPLS. Call your healthcare provider right away if you get headaches, seizures, confusion, changes in vision, or problems thinking. Wound healing problems. Wound healing problems have happened in some people who take Iclusig. Tell your healthcare provider if you plan to have any surgery before or during treatment with Iclusig. You should stop taking Iclusig at least 1 week before planned surgery. Your healthcare provider should tell you when you may start taking Iclusig again after surgery. A tear in your stomach or intestinal wall, perforation. Tell your healthcare provider right away if you get severe pain in your stomach area, abdomen, swelling of the abdomen, high fever. The most common side effects of Iclusig include skin rash, joint pain, stomach area, abdomen pain, headache, constipation, dry skin, high blood pressure, tiredness. Swelling of your hands, ankles, feet, face, or all over your body, fluid retention and edema. Fever, nausea, inflammation of the pancreas, increase in lipase levels, a blood test done to check your pancreas. Bleeding, low hemoglobin in the blood, anemia, liver problems, blood clots or blockage in blood vessels, arteries. Low blood platelet counts, low blood levels of white blood cells, including neutrophils. Your healthcare provider may change your dose, temporarily stop, or permanently stop treatment with Iclusig if you have certain side effects. Tell your healthcare provider if you have any side effect that bothers you or does not go away. These are not all of the possible side effects of Iclusig. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. To report suspected side effects, contact Takeda at 1-844-817-6468 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please visit iclusig.com for full prescribing information, including patient information.